to make sure that people understand the human toll that is taken when we do this. You know, in Atlanta, Georgia, where we have some of the highest levels of income inequality, and we have income and racial disparities in terms of health, it's absolutely front line. And I want to say, let's not forget about the role of the state, because our state's failure to expand Medicaid has been an absolute tragedy. I was interim executive director at AID Atlanta for a year as we tried to accommodate the ACA and get more people involved in insurance so that we could get more reimbursements. And now, as fast as groups have tried to make that accommodation, we now see this administration dismantling it. It is a tragedy and a train wreck what's going on, and I'd be very, very aggressive.
Mary, I think that's a really important point. I think you know the Republican legislature here, for the first time really since Obamacare, has begun to express more interest in expanding Medicaid. Are you in favor of the expansion of Medicaid? And as mayor, would you be down there at the Capitol lobbying in favor of it?
Absolutely. And as the independent in this race, I believe that I will be able to reach out to both sides of the aisle very effectively, both at the state level and at the national level. It is critically important that Atlanta come to the table as the city that serves everyone, as the city that is compassionate and caring for everyone, and that we make that point very clearly. So yes, absolutely.
Who wants to grab it next? John?
So Bill, it's about leadership. The mayor has been absent in this conversation, has been virtually absent. The mayor has a seat at the table. The mayor can have a voice. Number one,
I'm sorry. No. Are you suggesting that the mayor's relationship with Governor Deal, which is pointed to as an example of really wonderful cross-party cooperation?
It's limited. It's not in the health care. It is not in the healthcare arena. I want us to be clear on this. Under my watch as chairman of Fulton County, I reconfigured the health department. On the health department board, you have a seat for the chairman of the Fulton County board and the mayor of Atlanta. The mayor is at the table to be collaborating with the county. Has not said very little about Medicaid expansion. I use my role as chairman of Fulton County, lobby Congress, the local delegation, as well as going to Capitol Hill for Medicaid expansion. I was involved in the enrollment of Obamacare. And then related to this question, we must respect the role of the counties. Fulton and DeKalb County support Grady Hospital. The monies that are raised and generated support indigents. We must respect and collaborate and support the role of county government. And fourthly, there are health clinics around the counties. We should maximize their utility in terms of delivering health care for our citizens.
I gave you a few extra seconds because I interrupted you, but thank you for clarifying. Who else wants to give? Peter?
So the first thing I'd like to mention is we have as much great work as Grady has done. We have significant differences in lifespan in the city of Atlanta. We have 2 adjacent zip codes where your average lifespan in the northern one is 12 years longer than your lifespan on average in the one just to the south. These are adjacent zip codes. And this data has been known for some time, 12 years. That's an enormous statistical difference. And so Grady's role is so essential to keeping us where we are now, but improving. So the first thing I would say is we have to support Grady under all circumstances. So yes, I would support and lobby for the expansion of Medicare in Georgia. I would absolutely do everything I could to work across the aisle at the state and federal level to make sure that these payments are continuing. And if we can't continue these payments, we need to recognize as a community, counties and cities together, and it's more than just Fulton and DeKalb, we need to add other counties, that we have to find a way to support Grady Hospital.
I'd like to say, I think so much of it, Bill, has to do with prevention in many communities. My father died at 55 of heart disease. Both his parents lived to be almost 90, so genetically he should have lived longer. But because of lifestyle, because he smoked, he died at 55. And so I think from a city perspective, what our biggest opportunity is to work within our respective communities to make sure that there are resources for preventive measures as it relates to any number of our health problems. And as we talk about our centers, our community centers, and talk about wraparound services, that's also a component. It's not just about job training and education, it's also providing services and resources so that we can help people be well enough to get jobs and to stabilize communities. And I think that's a huge opportunity that we have from the city perspective, and one that, quite frankly, we haven't done the best at filling.
One follow-up, if you don't mind. Do you think the city of Atlanta, am I correct in characterizing us as being at something of a disadvantage? Because for the most part, this is a Democratic city having to deal with a Republican administration, our own congressional delegation, as well as the White House and Congress in Washington.
Well, you know, you've heard it said many times that there is Atlanta and then there is the rest of Georgia. So it's a challenge, but it's certainly something that it is what it is, and we have to take the opportunity to fill in where we can and do what we can from our perspective. The great part with the city of Atlanta now being financially stable, we have resources and opportunities to focus on our communities, quite frankly, that we didn't have many years ago.
We're not at a disadvantage. We're not at a disadvantage. There are red states that have Medicaid expansion. The mayor has not made a priority. That's the reason why there has not been a result.
Thank you. I know you want to get in, Michael.
Yeah, Bill,
and then I think you do, Caesar, too.
Well, we'll certainly never be at a disadvantage when I'm mayor. But what I would like to say is that when it comes to city leadership, you know, one of the things that I think we've got to focus on is behavioral economics. Jim Clifton writes in his book, The Coming Jobs War, that we spend about $2.5 trillion nationally on healthcare per year. That's expected to increase about 6% year after year. So we're looking at about a $10 trillion healthcare cost for the country over the next 10 years, and we've got to focus more. And the CDC says about 75% of the $2.5 trillion we spend per year come from preventable diseases. And so when you talk about city problems and city solutions, one of the reasons that we've been able to decrease smoking in half is because cities have led. Cities banned smoking in restaurants and in certain public places. So there's been an opportunity for the city to lead, and we've got to lead when it comes to prevention. We've got to do a better job of encouraging people to live healthier lifestyles and impacting where we can the behavioral economics of our constituent base, and lead on making sure our constituents are living healthier lifestyles and preventing these costs from continuing to increase.
Thank you. Caesar, I want to make sure I say the question again. It's about what Atlanta can do to assure federal funding that appears to be drying up.
I'll be really brief about this. It's about relationships, and it's about the willingness of the mayor to set the tone and leverage the power of relationships. I'm the only candidate up here that sits on the board of the ARC, and I don't just warm a seat there. I'm the only candidate that sits on the board of both the ARC, the Georgia Municipal Association, and really works hard to make sure that these organizations, which really comprise of Democrats, Republicans, and also independents, gets the work done at the state level and at the federal level. I work side by side every day in my law practice with former Senator Saxby Chambliss. I'm probably the only candidate up here that's been invited to the State of the Union by Johnny Isakson. That is because of relationships. When I'm mayor, I'm going to leverage every relationship that I have to ensure that we're getting our fair share of Medicaid here in the state of Georgia. The city of Atlanta is the capital city of the state and of the South. And when the mayor steps up and works with all of his partners around the state, we can make a true difference in terms of getting money not only from the federal government, but also from the state.
Okay, everybody's had a chance on this, right? Okay, Alexis.
Okay. It has been said that if you have a stroke, if you get shot, if you get stabbed, you want to go to Grady because that has the trauma center and the expertise to take care of you. But as mayor, what is it that you think you can do to cut down on some of the gun violence that perplexes the city? And let's start with Mr. Mitchell, and then we'll go to the right and then come back to Peter.
Well, you know, my father was an Atlanta police officer, and he believed in community policing. He walked a footbeat. When I'm mayor, I'm going to make sure our police officers are on the street, in the community, working with young people, protecting our seniors, and making sure that they know on a very granular level where the guns are. Because when you know where the guns are, you can go get them, number one. Number two, as mayor, I'm going to make sure we're partnering with nonprofit organizations, partnering with Fulton-DeKalb, the hospital authority, to ensure that we're buying back as many guns as we can and getting them off the street. Thirdly, I'm going to advocate at the national level for what I would call stronger gun technology, so that if you are stealing a gun, you can't use that gun because the technology of that gun won't allow you to do that. That's the future, and that's the work that we've got to do if we really want to be serious about getting guns off the street, disincentivizing the theft of guns that are proliferating in our community.
There are several things that we need to do. Number one, when we have 2/3 of the city that is seeing no redevelopment, no job opportunities for our young people, we have a desert. We have not only a food desert in parts of our city, we have a health desert, because when we closed down the Southwest Hospital, literally, it is so hard for citizens in that part of the city to get, whether to Grady or any of our other hospitals. So one of the things regarding guns is we need to have jobs for our young people. Right now, they see no future other than joining a gang and getting things illegally. And the second thing that we need to focus on is the adults who truly, I call it violence trafficking. When a 22-year-old gives a 14-year-old a gun because nothing will happen to the 14-year-old, we are literally inadvertently literally enabling young people to have a life of crime and lose their lives forever. So what do we need to do? We need jobs for the young people. We need the wraparound services like the At Promise Center. And we need, okay, I'm now, there's more. There's more. Thank you.
You were starting to sound like the disclaimer at the end of a pharmaceutical commercial. Trying to get it all in. Thanks.
No, Alexis, I've been on multiple sides of this issue. As a former federal prosecutor, I actually worked cases with the ATF in terms of seizing illegal guns, and I think we've got to do a better job at the city level in terms of partnering with our federal partners and doing deep investigations to make sure we're taking illegal guns off our street. I've also been robbed at gunpoint with an AK-47, surrounded by multiple guns, right in downtown Atlanta on Peter Street, where I was forced to be face down and robbed at gunpoint. And so I know, what gun victims go through, and just the idea that your life is flashing before your eyes. And so the issue is very personal to me. And I do think we've got to invest more in jobs. I'm happy to hear some of the council members that I'm running against talk about that, because you know how much the city of Atlanta has invested in the Workforce Development Agency. $0. The city of Atlanta has not invested any money in the Workforce Development Agency. We've been completely reliant on state and federal grants. And so when I'm mayor, the city will invest money in summer employment to help more youth have those opportunities we all know that they deserve.
Thanks for asking that question, Alexis. I think it's really an important one. We don't talk about it enough. Again, in my career as an advocate and within my own company, I've represented Bloomberg's Everytown USA organization for a number of sessions down at the Capitol. So I've worked against the expansion of stand your ground laws here and in Florida. I've worked against the Guns Everywhere bill and then the subsequent campus carry effort. We have a General Assembly that won't be happy until every single person can carry a gun openly anywhere, anytime they want to do it. And that doesn't make any of us feel any more safe at all. I agree with everyone in what's been said. We need to have more availability regularly for people to dispose of guns that they found, that they don't want in their house anymore. Not just sort of every couple of years it pops up, but regular opportunities for people to get rid of guns. And also I agree about the issue of youth job programs. We used to have a great youth job summer program. We don't really have it anymore, and I think giving kids the opportunity to get money and learn how to join the workforce is probably one of the strongest things we can do.
Thank you. Now, I did say we would go to Peter, but I want to change that and start with Kwanzaa and go down. So we mix it up a little bit.
Oh, thank you. Thanks. Well, I sat here and I thought about growing up in Southwest Atlanta and having access to guns as a child. 14, 15 years old, we had access, and that was 30 years ago. So think about what kids have access to right now. A whole lot more stuff. I represent the area with the greatest concentration of poverty in the Southeast United States, the Boulevard Corridor. Average income is $3,000 a year. Average rent is $12 a month. There are a lot of guns that were there when I came into office as a council member, but we worked to strengthen the families and children, to give them a way to own their own future with job opportunities, with job training, as well as access to support for their children. Because a lot of the young parents are 22, 23-year-olds who have access to guns. And the young kids have access to guns as well. So I think it's really about strengthening our communities from the inside out. People might not give their guns away because they don't feel safe in the community they live in. So that's part of the solution, is making our community strong from the inside out. Thank you.
So I think they have it completely wrong. You declare gun violence as a public health issue. You look at communities like a healthy community or a community that has diseases. You look at it from a public health perspective. Look at how trauma has an impact on young people and how it causes them to have a propensity towards violent behavior. You unleash mental health services. You provide wraparound services. You support the family. You create jobs. You have the communities or neighborhoods are a living organism. Some of them are diseased with cancer. Some of them are vibrant with people who are healthy. We look at it from a public health perspective, and you treat it from a public health perspective. That's the only way you can address and resolve the gun crisis in our neighborhoods of the city of Atlanta.
Thank you. I have practiced law for over 20 years, and during that time, I've served as a criminal defense attorney, a prosecutor, and a judge for 6 years. And what I know is that you can't legislate your way out of bad behavior. You have to get to the root of what the issue is. The thing that always struck me when I was a judge, when men would come in to fill out applications for public defenders, the vast majority of them had not finished 9th grade. That means that the problem doesn't start when they're 18 and 19 standing before a judge. The problem starts when they're in 3rd grade and they can't read. So as we talk about gun violence is at the other end of the spectrum. What we're really talking about is what are the opportunities, the educational opportunities for young people in our community. It really has to be about a proactive approach. We can't wait until they're 18 and they are facing murder charges. My nephew was killed 3 years ago, and what struck me is that the young men who killed him are young men who should have been his friends. They looked like him. So something has gone wrong along the pipeline, and I think that's where we need to fill the void in this city.
Thank you. As Chief Operating Officer for the city in 2010 and 11, I had the honor and privilege of supervising the police department and working closely with Chief George Turner. And I would go to a homicide scene every few weeks, and I would spend several hours. And I would get an opportunity to see every few weeks the devastating impact of gun violence on individuals, on families, on the community. We certainly have to partner with other organizations to get guns off the street. We absolutely have to do everything we can there. But ultimately, we are not going to police our way out of this gun violence challenge. What we need to do is put in place the full set of services that we need for people. We need early childhood learning, birth to age 3. We need a collaboration and a collaborative relationship with the Atlanta public school system. We need about 10 times more job training and job placement throughout the city so people can get jobs. And we need to do all of this in a very rapid fashion.
Thank you. I want to, if you don't mind, expand on that just briefly. Is there anyone of you on the stage? We know that it is unlikely that a Republican-controlled Congress is going to take much action in terms of restricting access to guns. Maybe they're going to pass, or they're going to allow for alcohol, tobacco, and firearms to put a regulation in place on bump stocks. Is there anyone on this stage who does not believe that Congress should be looking at further restrictions on gun control, whether it's access for people who have mental health issues? Should there be more attention given to waiting periods? Is there anybody who thinks the laws right now are exactly where they need to be? And if you aren't going to raise your hand on that, does that mean you all believe there should be some further action? Yes?
Yes.
Everybody?
Yes. Yes.
Further action.
Yes.
Okay. Thank you. I appreciate that. And by the way, again, thank you all. You're really being great in trying to keep to these time limits. So I want to move into a completely different area now because the authority actually asked all of the registrants to this conference what was the number one question they would like you to answer. And I'm going to basically read to some extent what they said. The number one question they wanted us to ask you is, what are your plans to work with local school systems to address literacy, dropout rates, and other factors that do contribute to poor health? Anybody want to grab that? Michael, I saw your hand first, and then Mary, I saw you. All of you will get a chance.
Well, thank you so much for that question. I think that's probably one of the most important questions. You cannot be a great city without a great public education system. And so I've often said, my grandfather used to tell me that when the elephants fight, it's the grass that suffers. And that's what we've seen a lot in our politics. We've seen a lot of infighting between City Hall and Atlanta Public School System. And when I'm mayor, I'm going to be the partner in chief with APS. What I've heard from teachers and from school board members and from administrators all over the city of Atlanta is that we have a hierarchy of needs issue when it comes to our kids. There are so many social challenges that our kids are facing that the city can partner with APS to address issues that are happening outside of the classroom that are impacting teachers' ability and students' ability to perform inside of the classroom. What we can do is partner with APS to find out what those critical issues are, what those social challenges are. And then we can help to solve and address some of those challenges by extending the hours of our Centers of Hope, providing mental health services, tutorials. So really being a partner in chief with the Atlanta Public School System. We serve the same families and neighborhoods and communities, and we ought not be fighting one another, but we ought to be working together to provide educational opportunity for all of our kids.
Real quick, and then everybody else want to answer this too. Michael, what do you say right now is the relationship between the current mayor of Atlanta and APS? What would you be inheriting in terms of that issue? Real quick, like 10-second
No,
response.
I mean, I think obviously the relationship is strained. There's been a lot of back and forth between deeds and the Atlanta Beltline issue that APS had. So I think the relationship is certainly strained.
Okay, Mary, I saw your hand next.
Yes, two things. Number one, I have met with the superintendent. We have discussed the goals that she has, and I have agreed with all of those goals and how the city can be helpful. Secondly, what has been really wonderful is that we now have the attention of the entire corporate and philanthropic community. We have 4 organizations who've gotten together to partner in a program that is called Learn for Life. And it's the United Way, it's the Regional Commission, it is the Community Foundation, and it is the ARC, United Way, Regional Commission, and fourth one. Do it in a minute. Those 4 organizations have come together and they are sponsoring all the superintendents of the 5 core counties and the 3 school systems to identify what the goals are. And the most important goal that these superintendents said was that all children have to be reading at 3rd grade level by 3rd grade. If we don't have them reading at 3rd grade level, it is a school to prison pipeline. So these organizations have come together in order to make that happen, and the 4th one was the Metro Chamber.
Good.
So
thank you very much.
you.
Who's next? Who wants to go? Peter, I did see you first out of the corner of my eye.
Well, I applaud you on your peripheral vision. So this is an issue that I've been talking about the entire 18 months I've been running. In fact, the issue of education in Atlanta is one of the reasons why I'm running. I often say that I am willing to bet whether I have a second term or not as mayor on whether I have achieved measurable achievements in partnering with the Atlanta Public School System and improving youth development in the city of Atlanta. We cannot be a great city without great youth development. So what does that mean? First,